Okay, our meeting is now being recorded for the statewide collaborative monthly meeting of January 7th, 2016. Here, everyone. I'm going to do a roll call from what I can see on my screen. If I miss anyone, please let me know. I have got on the line Cecilia Rivera. Cecilia, are you on the call? How about Crystal Ryder?
Yep, I'm here.
Great, good morning.
Good morning.
And Mitchell?
Yes, I'm here.
Awesome. Ellen Pilstrom?
Happy New Year, everyone. Yes, I'm here.
Great, I think you came on and came off and came back on.
I did. Sorry about that.
No, thank you for being patient with our Melissa Pruitt, I know you already did her. Whitney?
Yeah, I'm here.
Connie Young?
Yes, morning.
So I missed Cecilia. Do you have audio?
Yes, I'm in the computer and the phone at the same time.
Okay, awesome. Great. Glad to have you join us. All right. So anybody I may have missed?
Khadija, too, from the Center for African American Health, Glenda Mitchell's assistant.
Oh, okay, great. Say your name again, please.
Khadija, too. Ofana.
So that's how you pronounce the name.
Yeah.
Khadija?
Khadija, too. Yep, Khadija, too.
That's all one first name.
Yes.
Great.
Good morning.
Right.
It's Meredith. I'm also just on phone only this morning.
Okay, great. Welcome, Meredith. Anyone else that we might have missed on attendance? Anybody?
The video.
Well, great. All right. So we welcome you to our meeting, and we'll get started here. Our agenda for today is our introduction. Melissa and I will be sharing a little bit about a partnership that we're working on in Boulder County, and then we will do some updates from Connie Young of QA, talk a little bit about the support website, which is some good news, and then maybe even a little bit about what we might be doing with the sustainability meeting. I then featured collaborative updates, where we're at with a new chair, how we're handling 2016, the data that you'll be submitting to COA, which is pretty simple, and a little bit about our new website look, statewide trainings, and so forth. So with that in mind, let me click here. We did our introduction, and I'm going to move on to Melissa, our section.
All right.
Ready? So
I'm ready.
I'll scroll through the slides as you talk.
Okay, and if anybody has any trouble hearing me, please let me know, because as I mentioned, I am on speaker. So what we want to talk about is how we tried to do a new relationship with two Stanford license holders, and how we think that this has really become a successful collaboration. You can go ahead and change the slides. So I'll give you a little bit of background on this, and I will also read the slides since some of you are not able to see them. So if you are able to see it, I'm sorry for duplication. But really, you know, what I started looking at is what are the biggest obstacles I face when trying to plan a class. And I think the things that always come to mind for me are recruitment, age restrictions, and trained leaders. And these are really big challenges that we faced in Boulder County. And I think, you know, when I listen to the phone calls and talk to people about this program, I think those are fairly common challenges for all of us. So, you know, how on earth do you recruit for this class? Because trying to explain it has always been quite challenging for me. You want to, you know, let the audience know what it's about, but it's sort of hard to explain if people don't have a concept of self-management or don't even understand if they have a chronic disease. And then for us, the age restrictions how do you recruit when you really are, for funding purposes, we're looking at people 60 and over and their caregivers. And then, of course, the leader situation. If you train leaders to do your program, and in our county we do volunteers who train for who teach the classes with us, and I would get people trained, and then I couldn't get the classes filled, and then their interest would wane, and so it was just a challenge to keep enough leaders trained to be able to jump up and offer classes, and yet if the classes didn't fill, then I was losing them. So those were the big obstacles for me. And you can go ahead and change the slide again. So I took a hard look at, what is working here and what are the things that needed improvement. So for us, what was working is that we did have the funding for Boulder County residents 60 and over and their caregivers. And like many of you, we participated in the statewide grants, and then we had additional funding through our state unit on aging. And luckily for us, and we are different, I know, from some counties, we have a lot of support through the county. My position is a county employee, so I'm not paid through the grant, which gives us some more flexibility in terms of, having staff to coordinate the program. I also, over the years, have made a real concerted effort to develop some relationships with some physicians, with their care managers, with their office managers, with various therapists, with home care agencies. I've really been out, pounding the pavement, having presentations, talking to people, sending flyers, and much of the stuff that many of you do and we've talked about on these phone calls. But what needed improvement, what was really, continuing to be a challenge, was this didn't really result in a steady stream of referrals. And the inability to serve multiple age groups was just a huge problem for healthcare providers. They just didn't want to have a restriction on that. And of course, we could have charged for that, but it just seemed unwieldy, and I'll hit on that again in a few minutes. But those were certainly the things I needed to work on. And you can go ahead and change the slide. So trying to think outside of the box is what I wanted to do with this program, because I think, again, like you, we are committed to doing this. We know it produces good results, but it is just challenging to make that happen. So when I started thinking of, what could I do, I began to think of other license holders. Rather than a competitor, how could we complement one another? How could we take the strengths of other license holders and combine them with us to fill in gaps of service? And Mary Pat, time for you.
All right, thank you. So what Melissa did is she approached us here at COA and explained her situation and what she was thinking about, and that thinking outside the box. And I will just say that, Melissa, with Boulder AAA and COA, have some history. We have gone way back. We've shared master trainers, done some co-training, et cetera, et cetera. And so it was a comfortable reach out, I will say. And so we felt like the first step was to have a meeting, which we did. So that included the Boulder Community Hospital staff and our point of contact, Betsy, and Melissa, and some of her staff, and then some of the COA staff. So we had this big meeting in October 2014, brought all the partners together. It also included the leaders, which Boulder Community had already trained some of their staff, their clinical staff, as leaders for the program. And so they also were sitting at the table and ready and anxious to teach, but weren't sure how that all was going to look and play out, et cetera. So it was a great meeting of sharing where everyone was at, how do we establish a common goal, which the common goal was, of course, to serve the patients of Boulder Community Hospital. They have several clinics. They wanted to make referrals. They were ready, and they were committed. And so that was the easy part. And for Melissa and I, then it was just a matter of designing something that was going to really work for them. So with all of us having that same focus of what design works for our partner, our community partner. Not necessarily that it's an ideal design for AAA or an ideal design for COA or something we've done before, but we all wanted to think outside the box to meet their needs, and I think that was really key, that we all had that focus. Following that, then we did a presentation with their staff, which was care managers, patient navigators, some RNs, et cetera, that came to the table, and we discussed how this went, and that happened then in November. We really focused on the referral process, what that would look like for them to make referrals of their patients that they felt could benefit from these classes, and these classes included CDSMP and the diabetes curriculum, and then make it a comfortable referral process for them. They had felt like what they wanted to do was establish a point of contact within their clinical system, which is what they did, as where all registrations got funneled through. So neither COA nor AAA at that point were taking the registrations directly, but they were going through their staff. They'd sort of fill the class, so to speak, and then work with one of us in helping the class go. So we established a set of classes for 2015, and we kind of moved on from there. I wanted to point out the dates simply because I think it's important that we all understand that it does take time. It took us time. We had to plan this out. We couldn't slam dunk this. It took conversation. It took relationship building. It took trust, those kinds of things. And I think all of you, I'm sure, are aware of that sort of importance in its first establishing something like this, that you just can't rush into it. You have to sort of give it some time. And so we then developed the 2015 class schedule. So basically, in a few bullet points here, Melissa and I had decided we'll alternate hosting the classes. So there was a total of 8 classes done in that course of the year, but the schedule was such that what we basically tried to do was alternate. So Boulder community knew that for the March class, Melissa would handle all the logistics. For the April class, it would be COA and Mary Pat, et cetera, et cetera. And they felt fine with that. So that meant that we handled the paperwork. We made sure we got them the forms. We got them the class materials. Class site was scheduled. All those kinds of logistics and alternated responsibility. So it didn't all fall on Melissa. It didn't all fall on us. And that seemed to work pretty good. And Boulder was fine with that, as long as they knew who is the person I'm going to. And that might have felt confusing or seemed confusing at the beginning, but it seemed to work out really well, and I think it just smoothed out as we went through the year. And then, so what we did is we waited till the class was completed, and then we looked at the attendance, and we quote-unquote sort of split the attendance, and that's what we're currently doing. And I know in talking with Whitney, I think you said you and Ellen have done something similar to that. So once the class is completed, and they are able then to make a patient referral of any sort, any age, any county, they didn't have to worry about those logistics anymore. And so that's that win-win setup that we established. So when we got the attendance sheet, then Melissa and I would go through and go, oh, okay, look, 4 of these are Boulder County over 60, 3 of these are non-Boulder County, and 1 was Boulder County under 60. Something like that would be kind of how these would look. So COA would report only those that were non-Boulder County over 60. Melissa would report the others. So that's sort of how we ended up submitting then the information. So the data doesn't get duplicated. I don't report all of those people. She doesn't report all of those people. So as far as keeping it straight in our statewide data, they're only seeing individuals reported once. And that seemed to be the best way and how we're making that work. So we're pleased about that. And then I also just noted that now that we've also assumed licensing for Weld County AAA, which of course Weld County, butts up against Boulder County. There are sometimes Weld County folks over 60 who are also falling into some of these classes now, and we're able to give Weld County AAA those names. We just shoot those to them, and they're able to put them in their database. So that it's really kind of an extended win-win-win, if you want to call it such. So here's just a quick summary. We did 8 workshops between March and November. A total of 83 were enrolled. You can see, surprisingly, to us even, that Boulder AAA ended up with 44 or 53%, and COA ended up with 39. So it was almost a 50-50 split. This was really important for us to observe and watch, because it really affirms why this is such a wonderful win-win-win. So, you know, we were going to watch this and see, well, did they end up really being a lot of Boulder County over 60? Then maybe Melissa should just own this, and so on and so forth. So when we saw this in the end, we went, wow, that's kind of amazing. And I think the thing I really want to point out here is that had we not been able to share these responsibilities, neither one of us would gotten those numbers. So the 44 enrolled for Boulder AAA gives them 44 more clients that they've served in their county that may not have otherwise met a class minimum. You know, and I think that was some of the frustration that Melissa was feeling. Now, it doesn't matter if it's only 3 or 4 out of a class. She gets to count it. The class is still 8 to 10 people. And same with us. We picked up, you know, 39 more people. So we really feel like the work and the efforts have been well worth it. And again, I want to just reiterate the importance of, and I know Melissa would ditto this, it's really great to sit at the table and hear their coordinator, Betsy Duckett, go, this is so great for them. They're very happy that they don't have to filter through who's going to be appropriate for this class, who's not. They just look at their patient load, they see some needs, they make a referral, and we figure out the rest. And so they're very, very happy that it doesn't matter if the class is filled with Adams County, Wells County, Boulder County patients, which is their service area. So I really am pleased about that part. So Melissa?
Okay. So I just want to, you know, the numbers are one thing, and it is important to look at, you know, how many classes did you have and how many people did you serve. But I think for us, just knowing that, I mean, when we talk about sustainability, it is not sustainable to have one person working so hard to try to fill classes and then have them be canceled. So we didn't have a huge number of changes in the number of people we serve, but it certainly made it more possible to do it in the future without having to recruit for every class so hard. So I really found that a real helpful piece of this. But again, when you look at what happened here, support for a program doesn't necessarily result in a lot of referrals. And so what we found was, I could go out and talk to physicians, I could talk to the care coordinators, but they're busy. And they may think that your program is great, but they've got a lot of stuff that they have to cover with their patients. And if they have to think about, oh, is this person over 60? Oh, do they live in Boulder County? They don't really want to have to tell somebody to call me and that the program may or may not work for them. So having this ability to serve everybody without, as Mary Pat mentioned, you know, asking where they live or their age has just been a huge relief for me, and I think for them as well. The other thing that I found is that, you know, we are often one-person operations. So yeah, there are a lot of healthcare professionals in our area, and we can try really hard to get the word out there. But it's real hard. So we may have people who don't know about our program. So as we're able to reach more people and get these referrals from the physicians' offices, that really expands our reach. And I think that really is key to this. And next slide. So again, there have been bumps and challenges along the way, as Mary Pat mentioned. You know, when we first got together for that first meeting, we all had 3 different names we were calling this program. Who should do the marketing? What should we call it? Who sends out the flyers? Who does the registration? How do we report the stats? And each of those things could have been showstoppers, but we just kept working on it and trying to be creative in how we would do this. And I think we've worked out many of the major things. We're still working on a few things, but when you get agencies that were willing to sit down and talk, and I have to say that the committed partners is real important to why this worked. We have been doing this for a long time and want to keep doing this program. Obviously, COA is a leader in the state and nationwide in what they've done in their approaches with physicians' offices. And then we had Boulder Community Health, who really wanted to do this, but they needed to work under somebody's license. So they were a great partner and continue to be a really good referral source for us. Plus, they have some trained leaders, which takes some of the burden off of our county having to have enough trained leaders to do all these different classes. So I think all of those things came together to make a nice success for us. And I'll just finish with one last slide there. And you can see this is the current flyer, and I will tell you that the marketing continues to be a bit of a challenge. We have a arduous process in the county for getting new flyers designed, for getting them approved, and it takes way longer than I would like. So even though we're going with a Healthier Living name, we weren't able to get the new flyer ready for the January classes. But you can see this is what the hospital had developed and sends out through their portal, and we just put our various logos on there. We have now gone to registration through me. We're going to see how that goes, rather than having the care coordinators have to do the registration, because that made for too many different flyers. And we're going to see how this works and whether patients will feel free to call me. But that's sort of the current state, but I urge you to think about that in your area if you're struggling to keep the classes going, because it sure has been helpful for us.
Thank you, Melissa. Yeah, and so as Melissa mentioned, we did in our last meeting, so we have been meeting like semi-annually, about every 6 months, and evaluating ongoing and getting feedback, which has also been really helpful to bring all the parties back to the table. And so we obviously met to look at our 2016 schedule and plan, and what do we need to change. Registration was one of the issues. And so I think that might end up being a little bit easier for us. What we're going to do is, Pro is actually going to then do some flyers for chronic pain, which Melissa doesn't have in her menu of offerings, and we do, and the Boulder community was interested in chronic pain classes. So those particular classes we'll be handling the registration for. So again, it's kind of trying to share those duties and what makes the most sense for them and for us and all. But yeah, I think we got logos on all the flyers. That wasn't too hard, but like she said, who's doing the flyer, which marketing department, how's that going to look, how do we disperse them, and so forth. But it is still all ends up working out pretty nicely. And again, if we all kind of stay focused on what we're trying to do and who we're trying to reach, it really grounds us as we move along. So we just wanted to see if there were any questions.
Hey, Mary Pat, this is Crystal. I just have a quick question. So for reporting to Stanford, how did you guys handle that? Is it whoever, I see that how the number breakdown was. Is it by participant, or did the registrations that you took, is that when you reported it to Stanford, and then Boulder County, they reported the ones that they took the registrations for? Because it could be
we actually do it by the actual, after the attendance sheet is returned, and we find out who is from where, whether they're Boulder County, not over 60. And then we, AAA reports only those that are Boulder County over 60, and then COA reports the others. We put that into our own database, as well as the numbers that go to state, as well as then on to whatever Stanford information needs to go out. So we actually split it by individual. So the demographic information, all that is only recorded to the appropriate license holder.
Okay.
We have to have conversation after each class, and then we split it up accordingly.
Okay, thank you.
Other questions or comments, or if anyone else has a partnership that they want to share real quick, a highlight of or something. Well, if not, we hope that you'll find this a little bit helpful. And I feel like this is a really good example of something we should be doing maybe on the collaborative as we go into 2016 is a lot of the sharing, best practices, the strengths that each of us have as license holders could be highlighted throughout the year. I think that's a great way to network, and sometimes it could be challenges and how we've overcome them, or perhaps something new and different we're doing that others can learn from. So hopefully that sort of just sets a little template for you for the rest of the year on some advantages I think that this collaborative could utilize as we move through. I know the focus has been pretty strong in the last 3 years on our the grant that we've had through SUA, and there could be other funding opportunities that come along as well. But I think it's good for all of us to just be thinking about what are other goals and purposes of this collaborative, and I feel like something like this could be really beneficial to all of us. So I'm going to just leave you on that note. I do want to also mention, because the note was laid on my desk, that the reason we had the glitch, the entire CenturyLink area, this whole zone of our neighborhood was shut down with internet access. So that's not fun. We're actually doing this through an iPhone, which is kind of crazy. So this is another way all of us learn to be creative, right? How do we overcome another obstacle? So with that, I'm going to move on and let Connie Young share some updates from SUA.
Thanks, Mary Pat. And thanks to both of you for that presentation. That was really interesting, and hopefully gives people some ideas, but that's a great example. And it's something that seems like, it's up to all of you, but based on some of the conversations I've had with some of you around the state, it seems like that kind of partnership might be an option to, as you all said, keep the classes going, get enough recruitment, et cetera. So anyway, that was, thanks so much for doing that. As Mary Pat said in the agenda, that we would be talking a little bit about the online support community, and there's not a whole lot to say other than if you all got a copy of what I sent to Mary Pat that she sent to you yesterday. It's basically a free opportunity for anyone who has been through any class who is savvy with using the internet. It's open to anybody, but for people who don't have internet access or not comfortable with using computers or whatever, it's obviously wouldn't be appropriate. But one of the things that we talked about in another call was an issue that one of the physicians I had talked to brought up, which is his struggle with what happens after the class is over. How do they help people keep going, and are there any resources to support that? We did talk about some ideas before, and this was one that I wanted to bring up again. So it's kind of like a Facebook type of site with message board, and it's become more user friendly recently. So it's a lot nicer format, and there's resources that are listed there and opportunities to post questions and do some of the things that people do in the sessions themselves. So just want to encourage you to, however you can, get this information out to your leaders and let them know that this is an opportunity for anybody who wants to participate. It's free. They hope to keep it going indefinitely, as far as at the moment it is. So maybe on the last session, this would be an opportunity to make that information available to participants. Anybody have any comments or questions?
Hi, this is Glenda. So then that website really would only address chronic disease self-management, correct?
Well, I don't think there's anything specific to diabetes, Glenda, but of course, so much of what's in the CDSMP would apply to people with diabetes. But after the call, let me look it up. I think I still have a login. That would probably take too long to find and do right now. But let me look and see if there's anything specific to diabetes. Either way, I think it would be helpful, could be helpful to your folks, because if they're posting, excuse me, questions or comments related to diabetes, that sort of self-selects other people who have diabetes that might want to comment and share information. There may also be some resources related to specific to diabetes, but let me check on that, and then I'll send out whatever information I come up with.
All right, thank you.
Sure.
Connie, this is Whitney from Weld. Another question, if you're checking into stuff, have they seen any sub-use of people using it in Spanish? And is it at all friendly to people using it in Spanish, or should we mostly focus on our English-speaking classes?
That's a great question, too. I think it's only English, but I will check on that as well. Thanks for bringing that up. I hadn't thought about that. Any other questions that I don't know the answers to? Okay, great. Well, I will find that out, and I will send that to Mary Pat, or would that be all right, Mary Pat, if I send that to you and you could send it out to everyone?
Oh, you're sneaking me back in. That's not right.
I have the distribution list. I can send it out myself. I didn't know that you were making that abrupt of a departure, so.
Oh, no, I'm still around. I'm still around. You haven't gotten rid of me. I'm happy to do that, of course.
Okay. Well, the last thing we want to do is get rid of you, seriously, so appreciate that. I did have a couple other things. One is that I mentioned, I don't know if any of you remember on some previous calls, that NCOA was going to do what they called some learning collaboratives on a couple mechanisms for accessing Medicare funding. And initially I thought that these were going to be conference calls each month that each of the states could participate in. But the way they structured it was that they wanted to limit it to 10 states per approach. There's two different ones that I'll tell you about in a minute. And so there was an application process. So the two opportunities for Medicare funding are, one is the Diabetes Self-Management Program, which involves, for Medicare purposes, more medical oversight and medical services. So it's a slightly different program called Diabetes Self-Management Training. And then the other one is called the Health Behavior Assessment Intervention, I think, HBAI. And it's basically a way of, it also involves more medical services for people who might have some kind of behavioral barrier to take a class. And it's not meant as something for a serious mental illness, or it could be someone who has that, but it's, and I'll learn more about as we go along, but any kind of behavior that might prevent them from enrolling or successfully participating. So I'm guessing it could be something like stress, or maybe self-confidence, or other sorts of things along that line. But in any case, both of those are opportunities that exist now to tap into Medicare funding. They're not something that is accomplished in 2-3 steps, but they're both potentially very good possibilities and strong funding for people who put that into place. So I applied for the HBAI, and I approached Glenda to see if she was interested in applying for the DSMT, because as most of you, maybe all of you know, the Center for African American Health does exclusively the diabetes self-management, so they really have an expertise and an interest in that area. And I'm happy to report that both of us were accepted. So we'll have two of us working on those two types of Medicare funding, and we'll be reporting back to you all on these calls and other ways of communicating with you in the future. And I do want to give a lot of credit to Glenda and their brand new director at the center, as well as welcoming Khadija to the program. And Glenda really took the reins and tried to get this moving and get approval for it in a really short period of time, because there was a deadline that we needed to make. So I'm just really happy about that, and I hope that it will be something that we can all open up to people to participate in and tap into some Medicare funding for our programs in the future. Glenda, did you want to add some things to that, or Khadija too?
I do have a question for the collaborative. Is there currently anyone or any organization in the collaborative that is receiving Medicare reimbursement for CDSMP, DSM? Any of us, have we made that bold step?
Yeah, I'm not aware of anyone in Colorado, but there are other states, of course, and I don't know if they'll be involved with the collaborative, but of course NCOA, and there's one man in particular who's very knowledgeable about all the ins and outs. So hopefully there'll be some opportunities to learn from other states.
Well, and just in a nutshell, when we looked at the requirements of the goals of the project, the primary focus will be partnering with institutions that can help us achieve the American Diabetes Association criteria for reimbursement for Medicare, or the American Association of Diabetes Educators criteria to be reimbursed for Medicare. So as an example, as a community-based organization, we don't have any of those individuals on our staff, so we'll need to come up with processes through this learning collaborative to reach out and do some of the things that I hear just happen by COA, having worked with the Boulder Community Hospital, because those institutions certainly have diabetes educators, those types of individuals. And that is how we would need to partner to make the, to get certification for Medicare billing.
Okay,
so
great.
We'll find out more about all of that. I know that was a mouthful, but in the next few, it's going to happen in a year, we hope, and we'll be certainly bringing this these updates on a regular basis to this collaborative, if you'll give us some time on the agenda as we have learning around this, and so that we can all attain that status.
That sounds great. Thank you, Glenda. I also wanted to just briefly mention that the NCOA, or not NCOA, but ACL, the Administration of Community Living, our federal previous funding source, has announced another round of applications for CDSMP grants. The information so far was just an initial announcement. It sounds very similar, if not identical, to the one that the basic information that we received last summer or spring, I guess it was, for the round that started September 1st that we did not get. But we'll be looking at, when we get more information, whether that's a fit for us to apply for, and go from there. I just wanted to let you know that that is a possibility in the future. Also, Mary Pat had on the agenda to talk about the in-person meeting. Oh yeah, I guess you have that on the screen right now. So that's one of the projects that we have on the books for this grant year, so to speak, with the remaining funding that we did not spend at the end of August last year. And as you may remember, I mentioned that we were planning to do a one-day meeting, about half of which would be on state level sustainability issues, and then the other half would be on having COA do more of a training session with you all about some of the ways that they have been successful in accessing funding for classes outside of a federal grant. And you know, the example that Mary Pat and Melissa talked about this morning is one. But I've been impressed when I talked with Mary Pat about a number of different organizations, not healthcare and other, where they have succeeded in getting people to say, hey, yeah, it is worth it for us to put in some funding or get our own staff trained or whatever. So those are the two main topics on the agenda. I'm in discussion with Lindsay McIntosh about their that kind of focus of their part of the presentation, and I just wondered, it'd probably be a couple of months from now that we would be able to put something like that together. Most people on the call today are in the Denver metro area, but for Crystal, Ellen, and Whitney, since you're not in Denver, can you tell me whether you think you might be willing to, interested in coming to Denver for the meeting?
This is Whitney from Weldon. I would be open to coming. We've come for meetings in the past, Holly and I have, and as long as we know a lot ahead of time and can block it off in the calendar, I'd be open to that.
Okay.
Yeah, this is Crystal. I feel the same way. As long as there's time, enough sufficient time that we can block it out, then, and I can't speak for everybody on our staff, but it's something that we would look at. So.
Okay.
Thank you.
Hey, Connie, this is Ellen. Oh, sorry.
No, go ahead.
This is Ellen, and I'm kind of the same way. If we have a lot of notice, I'd love to make it up. So be good to see you guys.
Okay.
Thanks.
Okay, great. That sounds good. And when Crystal just mentioned that, I just realized that I should thank Southeast Colorado AHEC for agreeing to be one of our partners for the application. I'm jumping back, sorry, but I didn't think to mention them that they were agreed to be a partner for me on the health behavior assessment intervention part of the Medicare, to pursue Medicare funding through the Learning Collaborative that I mentioned a minute ago. But I talked to Doreen Gonzalez, and she was very excited and enthusiastic about being one of our partners for that, so I appreciate that. But as far as jumping...
Which one is working with you, Connie?
Southeast Colorado Area Health Education Center, which is in Pueblo, and that's Crystal Ryder that's on the phone.
Oh, great.
Today.
Oh, great.
Yeah. So more to come about the in-person meeting. And I think that's it for my part. Did anybody have any questions or other comments, etc.? Okay.
Right. Thank you, Connie. That was always good to
Sure.
get updates from SUA. So the next section of our agenda are just some updates from me as collaborative chair / as COA, and I wanted to just kind of, so I'm going to skip the first one and quickly go through the others. The first one then is the data collection, just again to reiterate that starting January 1, COA is going to be taking in all of the data that you guys have previously been submitting to Lori and or Lindsay Blackwelder. So we're offered to do that. And so now that kind of information, your class attendance sheets, your cover sheets, all the demographics, etc., will just sent to us and now hard copy of COA, and we'll start entering that data. We also are collecting non-disclosure forms and the webinar quizzes so that we have copies of all of that, and we've always been doing fidelity visits. So kind of all things data will need to come to COA this year. And so what we also like to do then is, I thought it might be helpful if through the collaborative we could periodically, I put down quarterly as a suggestion, post some of the data, or maybe just in general how our state's doing, what kind of numbers we have, what our reach is looking like, and not agency by agency per se, but maybe just collectively, if that would be helpful. How do people feel about that kind of feedback, or any other type of feedback that you'd like that now.
No, that's not going to work.
Questions?
Mary Pat, this is Melissa. There is a lot of background noise. It's kind of hard to hear you. I don't know if somebody has a speaker on and stuff's going on in the background, but it's a little bit tough to hear you right now.
Oh, okay. Yeah, I could hear some of that muffled sound too. Sure, if someone, yeah.
And yes, I would be interested in the data to answer your question, so thank you.
Okay.
Yeah, this is Whitney from Weldon. We'd be interested in the data too. Thank you guys for collecting that.
So we'll look at some process of providing that. And the other thing I want to note that if you, as an agency or license holder, want to get your report at any time, it's very easy for us to print that out and send it to you. So don't hesitate to ask us, you know, partway through, halfway, quarterly, hey, can you shoot us the data that we sent collectively? And we'll be happy to do that. Just want it to be user-friendly. You know, we want to be sure that it's not just sitting here gathering dust, but that it might be something any one of you might want to tap into. And so Connie already talked.
Mary Pat, Mary Pat, could I just ask a, whoops, could I ask a question?
Sure.
I assume, and we're just, I guess, wanted to ask, will you still be, will everybody still be trying to get Medicaid ID numbers for participants and including that in the data?
Yeah, I noticed with the data that we got from Lori, where it shows that as one of the columns, or however you want to say it. So I think it's still asked in the form. So whatever is collected, you can certainly keep track of that as well. Yeah.
Okay. Sounds good.
We've also already been hooked up now with NCOA to shoot all that information, as some of you may know or not, and I know Connie's well aware that all of this data then goes on to NCOA, so we've been able to hook into their link in with their database. Our IT people talk to their IT people, and we're all good to go. So know that all this information does get forwarded on to the national level. And that information as well that Connie just mentioned. They're interested in that from not only statewide, but national level.
So then, this is Glenda. So we're going to all receive a spreadsheet that will be used amongst us all, so we can report everything in the same manner.
I want to say yes, if I understand your question. Are you, have you traditionally been getting regular reports from Lori, or did you do by request? You would get a report.
Yeah, I've not seen anything since I've been here.
Okay.
So that's something we need to tap into, but it sounds as if they are requesting different data points that we don't currently gather, which may not be a problem, but I think it would help if we're all trying to submit it the same. It gets really difficult to manage everybody's data when it's not the same.
Yeah, correct. Well, my assumption is that all of the license holders have been using the same forms that we were authorized to use through the state a couple, well, probably 3 years ago now, which is all came down from NCOA, and then we've all adjusted our forms and paperwork to reflect that same gathering of information. So it's that the workshop cover sheet, the demographic form, I think they call it demographic participant survey, which has added the Medicare, Medicaid question. We know a lot of folks choose not to fill that out, but it is in there. And what am I missing? The attendance sheet. Those are all set forms that we all use as a statewide already. So I'm assuming it's that those same forms will now just come to COA that you previously sent to Lori Scott. And then we will download all that information into our database or a database that it's easy for us then to pull that out by your organization, by you as a license holder. We can pull up the data you've submitted to us and give you a report of what that looks like. So it will reflect all the information that's gender, you know, how many in the household, chronic conditions listed, et cetera, any of that that's on those forms. So I'm just saying that that's going to be available if you want to. We would want to know that you would like to get that, and then we can make that a part of our routine process. Whether that's, you know, I wouldn't say more than monthly, but we could do it monthly and or quarterly, or if you're getting ready to do a report and you want to see what you have currently for 2016, we can certainly fairly easily get that information. So I'm not sure what you're saying about the different forms. I guess we'll have to see everybody's forms. I just assumed they were all.
Well, Mary Pat, this is Connie. I'm thinking maybe since we're talking about a change in the data, that it sounded like what was being asked for would be different. And my understanding is it's just, and I'm sure about this anyway, it's just sending all the stuff you've already been sending to Lori Scott would now instead go to COA. And so it's not changing anything or developing a new spreadsheet. It's just sending those forms that you get from the classes as you have been with Lori. And then COA will upload it to the NCOA database, whereas Lori was doing that in the past. So it's just a change in where you send things, not in what you send.
Okay.
This is Crystal. I mailed some stuff, some paperwork to Lori Monday or Tuesday of this week. Do you want me to send it also to you, Mary Pat, or will she get it forwarded over to you?
She'll probably forward it to us. We just had a conversation, in fact, yesterday, and she said she was up to date on everything she had gotten and received, which it did include some classes even into November. But if you just sent something for 2015, she'll probably just forward that to us, because now she's no longer probably going to load any more of that. And so we still have some information from 2015 that needs to be added to the 2015 count, but we'll just load it ourselves. So if anybody out there, like, now Crystal, I think since you already sent it, I would just assume Lori will probably forward it to us, which she has.
Right. If you don't see it, let me know and I can resend it, but I'm sure she'll send it over.
But if any
and
of
who
you,
should?
I'm sorry, I was going to say, if any of you as license holders have a class information from 2015 that you've not submitted to Lori, then go ahead and send it straight to COA. And it is coming to Cheryl Wakefield. She'll be doing all the input. And I can probably just send you guys, I'll just use my my email list and send everybody who that point of contact is. If it came to any of us, we'll certainly get it to her, but Cheryl Wakefield at COA.org, or Cheryl at COA.org, SHARYL, Cheryl at COA.org. Some of you have already worked with her before. She's the one who will be inputting all the data. She's like the new Lori Scott. But I'll send that to you guys too on an email so that you have that. But yeah, we'll watch for that, Crystal.
I'm sorry, can you repeat that email address just one more time, please?
Sure, it's Cheryl, SHARYL, at COA.org. But then you'll need our mailing address too, if you're going to mail hard copy.
Okay.
Hey, Mary Pat, this is Connie. I was asked by NCOA to give them up to three names of people who could input data, and the names I was given by Lindsay were Harry McIntosh and Joni Saunders. I didn't give so Cheryl's name wasn't on there, so she's going to be doing data input. Then I think you'll need to give me her name and take one of those other three off, because I just sent them that, and they were going to add those people to have access to the database, and only those people.
Now let me clear that up with Lindsay, because it might be that she wants to, yeah, I think they're going to be the ones that pull it through NCOA, where Cheryl compiles it all here.
Oh, into your database?
Yes, exactly.
Okay, gotcha, then that's fine.
Keep it to those three, because we are dealing with other states as well and their data, and so those are our three point of contacts for NCOA.
Okay, yeah, I'm sorry, I thought you were saying that Cheryl was going to be the primary one uploading it to NCOA, so if that's not the case, then we're good.
Yeah, I apologize if that wasn't clear. She will be gathering all the data as she works with all the license holders, and if there's questions, if we need to clarify anything, if people want to request a report, that would all be Cheryl. But the contact with NCOA will stay Harry, Lindsay, and Joni.
Sounds good.
Yeah, I think you have the correct information. Sorry to confuse it. Any other questions on that, Keith? Okay, well, I'm sure it's a journey we'll be taking, and we'll always be on these monthly calls, regardless if we're chairing or not. So if there's questions, concerns, we can always get addressed here on the collaborative call, and or you can always contact us one-on-one. So let's see, we talked about the grant, so I was glad to hear that. And Connie, if you want to, keep in touch, because if you feel like it would be more, I don't know, if it's more advantageous for COA to make the application as behalf of the collaborative, we're open to doing that. But if you're going to do it, that's great too. So we'll just kind of see.
Okay.
It's always a gamble.
Yeah.
But wanted to let everybody know that our IT is working on the Self-Management Colorado website. There's some new looks happening, and they're going to be available relatively soon. So just kind of give you a heads up that that's going to look a little different, hopefully even a little bit easier to navigate through our website. So we'll keep maintaining that as part of our commitment to the collaborative. And I'm also going to just quickly mention, it's not a bullet point, but since Kelly's sitting here doing minutes, we have been talking here at COA, and we're going to have Kelly sort of head up a I'll call it a little mini version of our collaborative with commando leaders throughout the state, just kind of to meet collectively over a conference call, maybe in this format with a webinar, just to kind of let that group sort of have an opportunity to network and share. We know that in kind of reaching out across the state, there's some isolated leaders out there who feel a little bit like, their curriculum is a little bit different. Culturally, they have things they address. And we just thought it might be beneficial to allow them an opportunity to sort of network amongst themselves. It would be a Spanish-speaking call, and Kelly would help facilitate that. So we're looking to do one of those, not regularly and monthly like this is, but more once or twice a year type of it, and just allow all the commando control leaders to call in and have an opportunity to just network and share, problem solve, same kinds of things we do, but in the Spanish language it would be conducted. So that's just a heads up. We're kind of excited about being able to do that. As you know, of course, Kelly's a master trainer, and so she also may get tidbits of information through Stanford that she can pass on, etc. So if you have leaders under your license that teach in the Spanish curriculum, you might kind of let them know that, or let us know too, if you have leaders and you'd like for them to be contacted for this opportunity. It would be something like this. It'd be a webinar/conference call. I'm going to say in about 3 months or so.
I think that's great. That sounds great, Mary Pat. I'm glad to hear that. It's Connie. And I wanted to ask you, on the self-management website, that's for the collaborative, right?
Correct. Correct.
So would there be opportunities for collaborative members to give comments either before it's finalized, or comments after it is, about what things they think might be helpful to add or delete or update, etc.?
Sure. If anyone has ideas right now, I would say just go ahead and email those to me, and I can pass it on to our IT and see if that's something, one, they may have already addressed, or two, it's an easy fix. Not always when we do everything, but
well, I mean, even some of the content, is kind of, I don't know, some of it was written a long time ago, or
right.
Certain things that might be confusing if you think about someone who doesn't know anything about the program, goes on there and maybe they don't know what we're talking about with certain words that we use, that kind of thing. So
yeah,
I didn't. Yep.
No, that's good. No, definitely pass on it. And I think some of those comments have been shared. We've been collecting them, but don't hesitate, any of you, to shoot me an email with some of your thoughts or ideas, because it's always good to make it as user-friendly as possible. Good. Okay.
It might even be,
go ahead.
Sorry, last thought on that is just, it might even be helpful to ask some people who don't know anything about it to look at it, because I know it's like with anything, we get into our own jargon and we sort of know what we mean and where to figure out how to find something, but you know, kind of either, you know, just emailing some people, or if you wanted us to, any of the collaborative members, to find people who don't know anything about this program, go online and let us know, let you know what was easy, what was difficult, what they didn't understand, that sort of thing.
Yeah, I mean, that's fine. We've actually done some of that and gotten some, like, neutral party feedback to help us redesign it. But if you feel like you've got some key suggestions, definitely forward those on.
Okay.
Yeah, because we won't, you know, we don't have the opportunity to do this ongoing all the time. But this is a little window of opportunity. I know it's already under reconstruction, so I'm not, you know, sure if we'll be able to address all the issues, but I'm optimistic that we have perhaps done some of the things that we might hear about, but please forward those on to me. Absolutely. That's where we're spending some time on it right now.
Okay.
So that leaves us with the new chair for 2016. Go ahead. What do we got? I haven't heard anything.
Well, this is Connie, and I hadn't heard anything either. I was going to wait until you said maybe you had. No. Is there anybody on the call that's interested in doing it or considering? So that's something that I can take on. I would like to get input on how to best do that, whether we need to make some changes in how often we meet, days and times that to look at scheduling at a different time, how we communicate information, what's useful, what's not, that sort of thing. But it's, you know, important, and I know other people are, well, we're all busy with different things, but it seems to make sense for the state to step up and try to fill in at least one of the shoes that COA has been in for the past several years. So, so what I'd like to do is suggest keeping the February date, and then in the interim, I'll send out a survey to people to get your input and see how we can, what kind of changes might be helpful to structure this in the future. And there may be some things that we can't do that COA's been doing. And maybe I'll be in touch with Mary Pat, if that'd be all right, about what you've been posting on the website and all of that kind of information, if that sounds okay.
Yeah, this is Mary Pat, and I think that it can take on a new look. I don't want it to. I didn't want anyone to like to stay the same as far as a monthly meeting. Does it have to be, you know, the go-to meeting format? I mean, I think we can look at other options. It might feel like less of a load if we didn't meet every month. You know, for someone to take on. I mean, that's one thought. It doesn't have to be a webinar format. It could be a conference call if you don't have the software to do that. I mean, I was trying to offer other suggestions as well so that it doesn't feel overwhelming. And as you said, Connie, COA will continue to man the self-management website, and we'll do the data collection. We want to get very active members. We intend to attend every month as much as possible. it's just chairing it is something that's time for us to kind of sit down and spend our energy more on and time and staff time on this data collection piece that we've taken on, and as well as, you know, keep the website going and submit that kind of information. We always want to be posting classes and that sort of thing, and we'll continue to do that. But the role of the chair and the collaborative itself in the meeting format could look a little different. Yeah. It's very quiet out there. All right. So it sounds like we'll be hearing from Connie, and meanwhile, Connie, you and I can touch base too.
Sounds good.
So our last couple items then on today's agenda is just some statewide trainings. I posted a couple that we've got going. Have not heard from anyone else. So if you guys, anyone out there is planning a training coming up, please let us know. We want to get it posted on our website.
Perfect, yeah.
Very, very easy. I'm sorry, was that?
Sorry.
Perfect, yeah, okay.
Sorry. It's Ellen, and I just, somebody came into my office really quick, sorry.
It sort of kind of fit. That's what's funny. With such enthusiasm. All right, so I just continued on some future agenda items that have been talked about. One is that role of the statewide collaborative, and I'm sure Connie will kind of help address that, maybe even through the survey in our February meeting, sort of what we want that to look like for 2016. And then another topic that's come up before is how do license holders handle outside resource materials and classes. That could be a topic at one of the upcoming collaborative meetings. And we're always open for more suggestions, and I would say suggest now that probably those could go on to Connie, and she can filter through those as to when's a good meeting to include those. Any other suggestions at this time that we want to add?
I'm sorry, I don't recall us going over when the ALC grant in March will be due. Exactly, and what is it? The previous, I'm sorry, backtracking a bit.
Connie mentioned that earlier in the meeting. Did you want to just touch base real quick?
Yeah, there's not a lot of information about it yet, and they're estimating a due date of April 4th. It's really similar to what, well, not that you all saw, what they released last spring that we applied for, but it just, state agencies are, let me back up to see, state grants, tribal grants, so we might want to let them know about that. But the state grants, they're only going to award 8 this time. They awarded 10 last time. And it just says, it's really pretty basic, same verbiage as before, to make 2-year grants to approximately 8 entities to bring, quote, bring to scale and sustain evidence-based programs that empower older adults and adults with disabilities to better manage their chronic conditions. 2 goals is to significantly increase the number of older adults and adults with disability who participate in these programs, and to implement innovative funding arrangements to support the program beyond the grant period.
Okay. So,
and it's fairly high funding levels. It's similar to what they did. It's almost, I guess it is identical in terms of funding. The maximum for the 2 years, they're putting a lot of money per entity into these. So a minimum, they're anticipating the minimum 2-year grant amount would be $500,000, and the maximum 2-year total is $900,000.
But that was for American Indians. Was that?
No, I'm sorry. I was you couldn't see what I was doing. That's for how they describe the state grants. There's another category that I just noticed that I hadn't looked at, which is for tribal organizations, and it's actually the same 2 goals. It's just that they want to focus in tribal communities. So it's the same two goals about expanding the number of people who participate in classes and implementing long-term funding arrangements to support the program beyond the grant. So that's a separate one. Go ahead.
And what does ACL stand for, the acronym?
I'm sorry, I didn't understand that. Say that again, please.
ACL, I just wanted to know what it stands for.
Oh, Administration for Community Living. It's part of the U.S. Department of Health and Human Services.
Thank you.
Sure.
So then the state has already made those applications on behalf of the collaborative.
No, we just got the real bare bones description that I read you, and so we will, I'm guessing we probably would apply, but we need a little bit more detail to determine whether we think it would be a fit. It sounds like it may be almost identical to the grant announcement that was made last year, so you know, I don't know how likely it'd be that we'd be successful since we already got a grant in the past. But they probably, I had asked about that, and they'll have some additional description of what they're looking for, and I think they'll have something about previous grantees in that. So, but no, they're not due until an estimated date of April 4th.
Okay. Thank you.
You're welcome.
All right, thank you, Connie, for that clarification. So the only thing left is our next meeting date is set for Thursday, February 4th, 9 o'clock. I guess you'll hear more information from Connie. Congratulations, Connie.
Yeah, Mary Pat, I know you don't mean that, but thank you.
I'm used to you handing over the gavel through the phone.
Oh, good. I didn't know there was a gavel involved. That changes things. Looking forward to that.
Sure.
Connie.
Your name will get engraved on it.
Yes.
Connie, this is Meredith.
Hey, Meredith.
I just wanted to let you know that I've been on the website to sign up for the forum while you've been talking, and Glenda's question about if it's applicable to diabetes. What the website says is that it is made up of alumni of a variety of self-management programs that include CDSMP, Better Choices, Better Health, arthritis self-management, diabetes self-management, and pain self-management.
Yeah, I didn't, maybe I didn't make that clear. Thanks, Meredith. I thought I said it's for any of the programs like you just said. I didn't know if there's anything in there that's specific to diabetes, and maybe that wasn't Glenda's question, but since you're on it, do you see anything, any category or opportunities to communicate specifically or maybe exclusively about diabetes?
I don't on this first screen, and I also don't see anything about Spanish, but I'm just on the sign-in screen, so there could be further information. But
yeah,
I think that explains it, though. It does seem to include everything, so that's great.
Mm-hmm.
Yeah, sorry, I didn't understand the question quite, Glenda, because it is really, they really want to make it to anybody who's taken any of the, I know we use the CDSMP abbreviation often when we're referring to everything, but I'll, thank you, Meredith, and I'll poke around a little bit more and see if I find anything else that's specific to either Spanish language or diabetes.
Hey, Connie, on that website, it shows that there's a map that folks can go on and look to see what self-management classes are in the area. So I typed in Colorado, it's not showing anything. So it may be, I don't know if there's a way we can find out how to get our information put on that. So if somebody is looking on the NCOA, on this site, then they can see what's going around on statewide.
Which site? Oh, the online site?
Yeah, the health
The online. Oh, thank you. That may.
And there's a blue link that says map, so that might be something to look into as well.
Yes, thank you so much. I didn't know that. I will check that out. We can get that fixed. Thank you.
All right, if that's it, everybody, have we got all our questions asked and answered? Right.
Mary Pat, thanks for chairing this year.
Oh, you're welcome. Thank you. All right, well, I'm looking forward to a fruitful 2016 for all of us. So, Happy New Year, everyone. And watch out, snow's coming.
It's already snowing in Pueblo.
Oh, wow. Okay.
All right.
We've already got it in my neighborhood.
All right, so here we are. Happy New Year, everyone.
Thank you.